Hello, everyone. This is Dr. Ken Richmond coming to you live again from Washington State, Vancouver. I'm going to give folks a few minutes to get online and check in and see how things are going. For those of you who are watching this video, if it's a replay, just feel free to push hashtag replay in your comments so I know that you were listening and you tuned in to support. Today we're going to talk about part 2 of costly mental health issues in you and how that affects individuals in the workplace. Last week we started talking about anxiety and that was a pretty well received talk. So today we're going to talk about depression. All right. So again, this is Dr. Ken Richmond, board certified general adult psychiatrist, interest in telepsychiatry, and through my virtual visits, I help you to live your best life. All right. So let's talk about depression. Very sexy topic. Yeah, right. Just kidding about that. It actually is a serious mental health condition that is pretty common, and actually one of those conditions that tends to be underdiagnosed. We'll say undertreated. Although the common presence of depression in the population is pretty high. So we'll say undertreated, but has a significant burden on individuals as well as in the workplace. For example, it can result in such things as absenteeism, which is the reality that individuals are no longer present in the workplace. They're physically not there. Or presenteeism, which is basically they're physically there, but mentally they're not. All right, so you can see on both fronts, they can affect productivity in the workplace. But also in that individual's ability to function as an individual. I know that was kind of an interesting play on words there, but you get the point there. Depression is one of those conditions that we just can't continue to overlook. We think of those negative events that have occurred in the workplace violence, in healthcare settings, wherever individuals may find themselves gathered. So we have to wonder what's the impact of that individual's mental state. But that's not the point of today's discussion. It was just we really want to focus on, or at least I want to focus on, just a general overview of depression. Right. So I have a few questions posed and I wanted to see if anybody has some thoughts on them. But first one is, who thinks depression affects more males than females? Okay. And the second question would be, do you feel like depression can affect everyone or just certain people? And the third question, when and if you ever feel depression or feel depressed, how do you work through that? Okay, so to go through some of the symptoms, so we'll get back to some of those questions. When somebody feels depressed, they have a series of symptoms that they experience, and some of those symptoms are things such as sleep problems. They may sleep too much or sleep too little. In any event, it is not their normal degree or sense of sleeping. What we call insomnia, inability to sleep, and hypersomnia, they're sleeping too much. They also experience decreased interest. Things that they once found pleasurable, they no longer really care to do those things. If they enjoyed playing sports, for example, all of a sudden they don't really care to do those things. With the kids these days is to play video games. If they're no longer interested in playing video games, that may be a sign that something's going on. Okay, they can also be very irritable. Little things get under their skin, so that person may have a short fuse. Imagine in the workplace, if you have a boss who is depressed and they're irritable, your questions may not be well received. So that's something to be thinking about, how your depressed mood can affect how you interact interpersonally as well. They also have struggles with feelings of guilt, blame, shame, feelings of worthlessness, hopelessness, helplessness. So all these negative emotions and feelings that they tend to struggle with that in many cases they don't really feel that they can overcome. We add on to that poor concentration. So they're very forgetful about simple and basic things. For example, where they put their keys. They're watching their favorite show, but they can't really follow from one episode to the next. And it's their favorite show, so that already tells you it's already a red flag. or they may not be interested in looking at their favorite show. Again, another red flag to be mindful of. Appetite changes can occur. So that's where they may eat too much, or they may eat very little, what we call restricting of their appetite, or they may overeat. Comfort eating would be the term that we in the mental health profession may use to describe that behavior. So comfort eating, they eat too much. In any event, their weight may change. Restricted eating or lack of appetite, their weight will also change in terms of a decrease. So we always like to be, or at least when I assess patients, I always want to be mindful of how much weight have you lost and over what period of time. If you lost 20 pounds over the year, that's very different than if you've lost 20 pounds in the last 4 weeks, okay? And we get really more concerned as individuals experience more severe symptoms that can evolve into psychotic symptoms where they can hallucinate, and hallucinations can affect any of the 5 senses. The common ones are visual and auditory hallucinations, but you can also have tactile hallucinations, which are basically sensation that things are, on your skin. You can have olfactory hallucinations where, you can perceive abnormal smells that may not be in an environment or no one else can smell. That's why we call it a hallucination. And finally, you can also have gustatory hallucinations, which are hallucinations that affect your taste, okay? So we have seeing, hearing, touch, smell, and what are our 5 senses? Come on, help me out. Put it in the comment section below. You got it? Okay, so we'll come back to that one, see who figured out which one I left out there. So the impact, again, is that individual may not function well. I always go back to the fact that if somebody has symptoms to that degree and severity, where they're not able to function in social settings, occupational settings, if they're in school, in academic settings, marriages, so interpersonal relationships there, that's where that can take a significant impact. Again, when it comes to treatment, you want to talk to your provider or close supports that you have in your life, but mainly a provider if the symptoms of depression are that severe and that noticeable, to get the help that you need, okay? There's no need to suffer in silence, and though many of us tend to do so. So I want to get back to those questions I posed earlier. One being, do you think depression affects more males than females? Well, in fact, it affects more females than males, mainly because females tend to get treatment sooner or recognize when things are not going well with them versus males. Does depression affect anyone? Yes, it can. There's no discrimination of what clinical symptoms can occur in individuals. It can happen in the child and adolescent age group, the young adult group, and obviously the geriatric age group as well. And yeah, I'm interested to know, when you feel depressed, how do you work through it? What do you do? Do you ignore it? Do you reconnect? Do you disconnect from things that may be stressing you out? But I'll be curious to see what those things are. Okay. All right. So going back through the 5 senses here. So we have auditory hallucinations, which are hearing. We have visual hallucinations, which are seeing things that aren't there. We have olfactory hallucinations. We have tactile and gustatory hallucinations. So again, those are the 5 senses where severe symptoms of depression can really start to affect individuals. And those are some of the high points I wanted to talk about as it pertains to depression. Well, thank you guys for tuning in. Again, this is Dr. Ken Richmond, DrKenRichmond. Thank you all for checking me out, and I look forward to seeing your comments that you'll leave below. Let me know what are your thoughts about depression, and if there are instances where you felt there were individuals you can help support and help get through their depressive episode. Hey, Amber, I see that you're signing on. Thanks for checking me out.